simulation room, we have multiple different types of equipment. We have cardiac monitors, we have code carts, we also have simulators, we have high fidelity mannequins, so tactical mannequins. We also have mannequins that can give birth. We have pediatric mannequins that can mimic a real patient. We also have in our simulation room our syndavers. Our syndavers are similar to a cadaver, and we keep them in liquid to keep them nice and pliable, just like the human skin would be.
Okay, inside our simulation ambulance, the setup inside here is very similar to what you would see inside a normal ambulance that you'd see running out in the field. In addition to that, we have a camera up in the corner in which we can record the students' progress as they go through a scenario. These high fidelity mannequins are controlled by a little computer box in which we can generate breath sounds, pulses, basically any function that a live patient can do. We can simulate with the mannequin so that the student can develop their assessment skills and not just be able to recognize things by verbally being told that a patient has a certain sign or symptom. They actually have to pick up on the fact that the mannequin is presenting a certain way.
The simulation room and all the equipment found in it are put here to help create a real life scenario so that we can test our students as close to the real thing as possible before we send them out into the field to actually experience a real live patient.
Here we have what we call our breakout rooms. We have a total of 6 breakout rooms. In this first breakout room, we have what is basically a simulation of what a residential home might look like, in which we can have a patient that's in the bathroom and having a medical emergency inside a bathroom, and how we're able to move and manipulate patients out of a home. We also have a simulator over here that simulates a motor vehicle collision.
In our second breakout room, we have a room dedicated to starting intravenous lines, specifically to help people learn not only how to start an IV line, but also how to give fluids and give medication, as well as starting a piggyback of an infusion. We also have medications, and those medications are ones that you will find in the field being used today. And when we use these for training, we have taken the original packaging, but we filled it with saline or some type of fluid that is not the actual drug, just for safety purposes.
Here's our third breakout room. Again, we use these rooms for testing purposes. And over here we have some beat-up mannequins that can simulate our trauma patients. Old mannequins that we've had that are starting to fall apart, that maybe have a missing leg or an arm. So we utilize them, and we can moulage these mannequins so that they look like they have real injuries in which the students can assess and evaluate their ability to handle a trauma scenario by bandaging, splinting, doing C-spine precautions for all these patients.
And this is the airway breakout room. In this room, we have equipment set up for students to be able to practice their ability to start an advanced airway in both an adult and a pediatric mannequin. We also have in this room the equipment to start a small volume nebulizer in case the patient might need that, as well as putting that patient on CPAP and even a ventilator.
In this room we have our IO skill station, in which we practice doing an interosseous infusion. We have all the equipment that's necessary, saline that we can infuse into our patients. Something that maybe you wouldn't get an opportunity to do in the field on a regular basis. We can simulate it with these mannequins. And here we have our anatomy and physiology room called our A&P room. So here we have a larger than life heart, which you can see all the valves, chambers. Here we have our bones man, in which we have to be able to identify all the major bones of the skeletal system. The pulmonary system here, version of the heart, kidneys, the skin, the brain. Here's our favorite man, our muscle man, our abdominal man, in which we can view both the heart and all the abdominal contents and be able to take them back out of the mannequin and piece them back together inside. Also up here on these shelves, we have various other models to aid in our teaching of anatomy and physiology for our students.
Cool. Done. We also have a video skills department here at PSESI where we try to use that camera to digitize difficult skills for the students so you can stream them while you're on your clinicals and really get the material down and watch it as many times as you need.
Well, here's the cool thing about this.
It's the next upright deflection in most cases after your QRS. So P, QRS, and then your T is your ventral relaxer.
Started at a cardio version of 50 joules to 100 to then 150.
Number 2, have an outline. Number 3, be able to verbalize everything.
You always want to have a working hand and a free hand if possible. Let's say you poke and moving it to the side to slide over the end of the needle. So we're starting at an angle, get our flash, and this is what a flash looks like.
36 molecules of ATP. You're probably wondering, okay, why is this important to me as a paramedic student and as a practicing paramedic when I get out there in the streets?